6 is the St. Vincent Mobile Medical Unit comes in as is required in grades kindergarten, 6th grade, and 11th grade. Physical exams are required if they're not done by their personal physician. We provide those physical exams at $15. Mr. Bill, I'm not going to be excited about that. Our next item under 15.05 is the International Institute of Erie agreements for the 2016-17 school year. And, excuse me here. Ed, this is yours as well? The International Institute?
Yes.
Okay. Can you?
Sure. We have an agreement with the International Institute. We have approximately 100 students in the district who are speaking languages other than English. So if we are having a meeting with their parents, whether it's an IEP meeting or any kind of meeting, and the parents request interpretation, we make arrangements with the International Institute to have an interpreter present at the meeting. We can help explain to the parents and help facilitate that meeting.
Yeah.
At $50 an hour,
Correct.
is that portal to portal?
I'm
Is
sorry?
that portal to portal?
I'm not sure. I don't understand what you're asking.
When you contract with someone as a consultation, right, do you pay the individual per hour from when they leave their office or residence to when they finish the interview or whatever they're going to do, then back to their residence? Portal to
I understand what you're asking. The way those contracts are generally, those agreements are generally drawn up, it's usually for 1 hour of the meeting. So it's the meeting time of an hour. So, if the meeting's 40 minutes,
Do
that's,
we get reimbursed for that $50 an hour?
there's no reimbursement for
There's
that.
not. Have you ever tried to?
We file a lot of these contracts for what you see here, we'll use to receive access funds for it. So we may not get the entire $50 back, but we'll get a percentage of that.
Okay. But there is a process of at least getting something back
Correct. Well,
for
we try,
providing the services.
as long as any services we provide are under the access umbrella, saying that you can claim those, we do claim them.
And some of these would be and some of these wouldn't be. Some of them would be medically related, but some of them aren't. Just to give you a little more clarification, our budget amount, our line item in the budget for this service is $1,500. So we don't use it tremendously a lot, but when we need it, we do use it.
Thank you.
Okay, we're going to move on to 15.06, which is a juvenile probation office contract for the 2016-17 school year. This is an individual where we pay him $5,000 a year. Erie County pays his salary and benefits, so we just pay a very small contribution for his salary.
And I would assume, Mr. Hosford, that this is like a position description?
For
The SBPO will participate at weekly screening meetings, and they participate.
of the academy.
Right.
Sure. So the position is the gentleman who's done the job since I've been here is Doug Miner. So he's a juvenile probation officer. He works for Erie County. That's his employer. So our contract with Erie County. 5 years ago, the district was paying $50,000 towards his appointment, and since that time, we've looked at this position multiple times to bring it down to what it is now, which is $5,000 a year. We contribute that, and so basically what happens is we pay $5,000 towards his salary and benefits, and he's actually placed or stationed. Erie County could change that. They don't have to keep him at McDowell, but that's where his office has been for the since I've been here. He has an office in McDowell where he works with the students who are in the district who are on probation. He also works with the students at the middle schools.
So he's actually here between 7:30 and 2:45.
Yes.
And we're literally only paying 10% of this salary, because you said we used to pay 50.
And that's not probably his entire, true salary is more than that.
What
You
is
said
his
it was
salary?
15 or 50?
I have no idea what the salary is. I would imagine it's well over 50,000.
That's what we used to
Yeah, you
pay.
said in the past, we used to pay 50.
That's what it used
Yeah,
to
so I
be.
mean, we got it down to 10 cents on the dollar. And, you know, it says up to, it'd be nice to live in a dream world and say we have 0 kids on probation, we wouldn't need them, but it doesn't work that way. So I think, you know, that having them readily available is the right thing.
It makes a big difference in the schools to have them be able to sit on those school-based teams who are working to keep those kids in school and being successful. So it makes a world of difference having them here. And that's a little bit of incentive for the county to keep them here.
He also has gone into classrooms and spoken on areas that he's got some expertise in. He's also worked with some students that are not on probation in order to prevent them from getting on probation. And it's really a valuable service in the high school.
Does he work with the, well, no, it's probation. He wouldn't work with the SRO, right?
Yeah, they work together in some cases, yes. The school resource officer and the probation officer have shared an office area. That's not going to happen this next year because there's some changes to that arrangement, but they do work in collaboration with each other at times.
Moving on to 15.07, we've got a similar contract as we had earlier, but this one is the school dentist contract for the 2016-17 school year. We'll be using Dr. Johnson again, and we will be paying him $6,000 for conducting those dental exams for kids entering kindergarten and grades 3 and 7. To 1508, which is the Mill Creek Paramedics contract for CPR, AED, and first aid instruction. We have this contract which we had a few months ago, which we will be offering for teachers to be to assist them with CPR and first aid training and instruction.
Question, do we have an AED device in all our buildings?
Yes, we do.
15.09, the Achievement Center contract for therapy dog services for the 2016-17 school year. I know at a board meeting, honestly, it was towards the end of last year, we had one of the student groups in here. They brought the therapy dog in here as an example. So that is what we are looking to approve at our meeting at the end of the month, their contract for the therapy dog. And then our last item we have is all of the fall athletic schedules for football, volleyball, girls basketball at middle school level, cross country, and a number of other athletics. We're just looking to approve those as well. Do we have any comments from the public for the instruction Student Services Committee?
I don't have a comment, and I just have a question. Last month, there was something that I was reading where the criteria for homeless and ADHD services is going to change. Can you just clarify what those changes are coming?
I can clarify the homeless piece for sure. So this is the ESSA that you've been hearing about, the Every Student Succeeds Act, which is replacing No Child Left Behind. So there's, you know, the feds just published the 100-page, you know, changes in all the protocols today, and I jokingly told Brad Whitman, who's our IU liaison, you know, when we were going to get the cliff notes for it, but we did have some insights to it. The homeless regulations, how that's going to change again, it's going to change some little things, like if a student who's homeless at any part of the time in the year, once they become housed, this is one example, the districts were no longer required to provide transportation. The districts will be required starting this year to provide transportation for the completion of the entire school year, even when students become housed, regardless of, you know, how far